I'm Dr. Guru N. Reddy. I'm Chief Gastroenterology and a Senior Consultant here at Continental Hospitals. When a patient develops chronic liver disease, what we call as CLD, and this chronic liver disease can happen from abuse of alcohol or from a previous infection with viruses, as I mentioned, with hepatitis B or hepatitis C, or for reasons like metabolic liver conditions if somebody has Wilson's disease. And there are a lot of other pediatric conditions that can lead to pediatric liver diseases, which can lead to chronic liver disease. Now, for chronic liver disease, unfortunately, there are no good medical therapies in spite of extensive research over the years. So what is the end point for these patients? The end point for these patients is to give them a new lease of life is liver transplantation. And liver transplantation is very commonly done in most of the countries now. Western countries have taken the leadership for a long time. In India, liver transplantation is done in many centers today. In live donor liver transplantation, one of your relatives, a friend who is willing to donate the liver, and half the liver usually, and that liver is taken from the patient who is donating and transplanted to the deceased person. So live donor liver transplantation is very popular in the Indian circumstances because we do not get enough cadavers to take care of the huge volume of patients who are needing transplantation. We at Continental have done several liver transplantations, both in the setting of somebody requiring live donor liver transplantation as well as deceased donor liver transplantation. Now, what is important in liver transplantation is that, again, the facility, because patients are at a very high risk of infections because they are immunocompromised, they are on immune suppressive agents, which means to say that when a new liver is transplanted, the body can reject. So because the body can reject that liver, we use many drugs to prevent such rejection. And these drugs are called immunosuppressive medications. Now, immunosuppressive medications means you're suppressing an immune system. As a consequence of that, patients are at increased risk for infections. So after the transplantation is done, which is the most crucial time, that patient is kept in a proper setting, an environment which is not prone to infections, and they can be safely treated for the next few weeks and discharged from the hospital. Now, good operation theaters, critical care units, post-transplant recovery setup, availability of various consultants to take care of if any problems arise. In today's world, transplantation is highly successful. 80% to 90% of the patients can absolutely survive beyond 5 years with no issues because the techniques have improved, the organ harvesting has improved, and perioperative complications have decreased, and we have better immunosuppressive medications to take care of these patients. So it's a very complex program which is run in tertiary care hospitals like Continental Hospitals, and we have success in many organ transplantations, not only liver, also in kidney, also in heart transplantation.